Hi everyone and good evening. Welcome back to my channel and presentation. I hope you like my content. Please subscribe to my channel and let's start my presentation. And in previous section we have discussed so many questions from AIMS previous paper. Okay, so today also I came back to explain some more questions to you. Okay, in that first you can see the question. The first question, complex parts is a clinical feature of which communicable diseases? And I give you options: cholera, chickenpox, measles, or pertussis. And the answer is measles. Okay, so here you can see actually what is a complex parts. Complex parts are small bluish white spots, and these spots appear on buccal mucosa or inside the cheeks. And not only that, these complex parts is the diagnostic feature of measles. Okay, then next second question, the universal donor, which type of blood group we can call universal donor? That is the O negative. And next one, loss of urine resulting from cognitive or environmental factor is manifestation of which urinary incontinence? Okay, so the answer is functional incontinence. Okay, so here you can see types of incontinence of urine: overflow incontinence, functional incontinence, surge incontinence, reflex incontinence, stress incontinence. Overflow incontinence is caused by overfull urinary bladder, and functional incontinence caused by because of cognitive or environmental factor, and urge incontinence is caused by overactive bladder, and reflex incontinence caused by uh, loss of warning from the nervous system. And not only the stress incontinence is caused by because of heavy pressure, and this stress incontinence also we can see during coughing, laughing, and sneezing. Okay, the next one, fourth question, you can see one community health center covers dash population in hill areas. Okay, so how much population it covers? I give you options: 80,000, 10,000, 50,000, 30,000. And the answer is 80,000. Okay, in hill area it covers 80,000 population, but in plain area it covers 1,20,000 population. And not only that, PHC, primary health centers, cover hill area 20,000 population, and in plain area it covers 30,000. Okay, compared to the hill area, the plain area covers more population. Okay, the next fifth question, the number of all current cases of disease at one point. The number of all current cases of diseases at one point of time called. I give you options: uh, period prevalence, point incidence, point prevalence, time prevalence. And the answer is point prevalence. Okay, here you can see the point prevalence. The number of point prevalence is nothing but the number of existing cases of diseases by number in total population. Okay, so that is a period prevalence. Okay, so here you can see point prevalence and period prevalence. Point prevalence is nothing but number of all current cases of disease at one point. At one point we can say, but some period of time. Okay, during period of time, so that you can call the period prevalence. Okay, next question, you can see hardness of water expressed as. Hardness of water expressed as mg per liter or milliequivalent per liter. And the answer is mg per liter. Okay, then next question. Okay, then in which year RSBY introduced? In which year RSBY scheme introduced? And this RSBY scheme was introduced in 2009 or 2008, 2006 or 2004. And the answer is 2008. Actually, what is this RSBY scheme? So this is one of the health insurance scheme for below poverty families, and in that scheme they have the benefits to take dental issues and they also get the maternal benefits. And not only that, in that family up to 5 members eligible to take this scheme. Okay, then next question, 88th question. What is the route of administration of hepatitis B vaccine? Route of administration of hepatitis B vaccine is IM, IV or subcutaneous, and the answer is IM. Then constant presence of disease or infection within a given geographic area. Constant presence of disease or infection within a given geographic area. Epidemic, endemic, sporadic or pandemic. So here in a given geographic area, and the answer is endemic. Okay, so here you can see sporadic is nothing but irregular occurrence of diseases, endemic presence of diseases in constant and increasing, or epidemic covering a particular area, pandemic covering large geographical area. Okay, so here what they asked the question, constant presence of diseases within a given geographical area. So within a geographical area is a endemic. Okay, the next question, denominator to calculate the crude birth rate. Denominator to calculate the crude birth rate is, so here you can see, so this is the formula. So denominator, so this is the denominator. Okay, numerator, denominator. So here what they asked, denominator to calculate the crude birth rate, here mid-year population in that year. So this is the formula for that given geographic area during given year, and mid-year population in that year into 1000. Okay, then next question, theme of World Health Day. World Health Day in 2019, in the year of 2019, and the answer is universal health coverage, everyone, everywhere. Okay, and here you can also see the theme of World Health Day in 2024, my health and my right, and in 2023 health for all. And all we know that World Health Day is celebrated in the month of April 7th, 7th day. Okay, then next, what is the minimum contact time required for chlorination of water to take? What is the minimum contact time required for the chlorination of water to take place? 30 minutes, 20 minutes, 10 minutes or 5 minutes? And the answer is 30 minutes. 30 minutes is the minimum time is required for chlorination of water. Okay, next, which enzyme is responsible for protein digestion? Okay, which enzyme is responsible for protein digestion? And the answer is pepsin. So the pepsin is one of the gastric juice, and so this pepsin primarily responsible for protein digestion. Okay, gastric juice. Okay, so now here actually the protein digested enzymes are simply we can call peptidases, and this peptidases is also classified into endopeptidase and exopeptidase. And here endopeptidase examples are pepsin, trypsin, chymotrypsin and elastases. And exopeptidase examples are carboxypeptidase and aminopeptidase. And protein digestion takes place in stomach and small intestine. Okay, the next one, next question, emulsification of lipids in small intestine require. Emulsification of lipids in the small intestine require gastric lipase, pancreatic lipase, or pepsin or bile salts. And the answer is bile salts. Okay, the next one, which of the following nutrient provide energy to the body? Which of the following nutrient provide energy to the body? Zinc, vitamin D, vitamin A or fat? And the answer is the fat. The next, all we know that carbohydrates act as a fuel of body. Okay, the next one, present precursor of vitamin A. Okay, precursor of vitamin A is pyridoxine, beta carotene, thiamine, retinol, and the answer is beta carotene. Beta carotene. Okay, the next, an average healthy person with no disease should ideally get dash of his or daily calorie requirement from healthy fat. So how much calorie the person can get daily from fats? That is 20 to 30%. Okay, the next, 98th question, which organ does the absorption of iron takes place? Which organ does the absorption of iron takes place? Duodenum, liver, stomach, or colon? So here, small intestine, duodenum, the part of duodenum that is in small intestine. The next one, B vitamin, also known as thiamine. B1 vitamin is also known as thiamine. Okay, here you can see the B complex vitamins B1, B2, B3, B5, B6 and B12, B7, B9 and this is deficiency. So B1 also called thiamine, riboflavin, niacin and pantothenic acid and pyridoxine, cobalamin, biotin, folic acid. Okay, so the pellagra is caused by because of B3 deficiency, right? Okay, the next question, trace elements essential for the synthesis of insulin. Trace elements essential for the synthesis of insulin. So which trace element? Cobalt, iron, zinc, sodium. The answer is zinc. Okay, then essential amino acids. The example of essential amino acid is pyridoxine, thiamine, niacin. Pyridoxine, B6, nothing but B complex B6 vitamin, and this is essential amino acid. And the functions of pyridoxine you can see, production of RBC and proper function of nervous system. For proper functioning of nervous system, this B6 is essential vitamin. The next one, calories generated per gram of fat approximately 2 calories, kilocalories, 4, 5 kilocalories or 6 kilocalories or 9 kilocalories. The answer is 9 kilocalories. Okay, then here you can see each carbohydrate, proteins and fat. The fat generates 9 kilocalories, carbohydrate generates 4 kilocalories and protein generates 4 kilocalories. Okay, the next one, proton pump inhibitor following drug. Proton pump inhibitor following drug is, or example of proton pump inhibitor is, and the drug is pantoprazole. Okay, and this pantoprazole is one of the drug, and we use for controlling stomach acid production. Okay, the next question, diabetic insipidus caused by deficiency of which hormone? Insulin, ADH or glucagon or renin? And the answer is antidiuretic or vasopressin hormone. Okay, and here you can see name of the surgery. There is a removal of duodenum, head of the pancreas and gallbladder and bile ducts. So what surgery we call? Removal of duodenum, head of pancreas, gallbladder and bile duct. Pancreatic duodenectomy. Okay, the next question, loss of ability to recognize objects called? Loss of ability to recognize objects called? The answer is agnosia. Agnosia. So here you can also see the some terminology: dysarthria, alexia, So dysarthria is nothing but, so whatever muscles we used for speech, so that muscles become weak. And alexia is nothing but inability to read or written words. Okay, then next question. Glandular tissue cancer called adenocarcinoma. Okay, other type of carcinoma also you can see, that is sarcoma, liposarcoma, and neuroblastoma. Connective tissue cancer or soft tissue cancer called sarcoma. Fat cells or adipose tissue cancer, liposarcoma. And a nerve tissue cancer we can call neuroblastoma. Okay, the next one, cell mediated immunity carried out by B cells, T cells, or both. So here the answer is T lymphocytes. Okay, so the humoral immunity mediated by B cells and cell mediated immunity mediated by T cells. Okay, just you remember ticket collector. Okay, the next, lateral shape curvature of spine. Cell mediated immunity carried out by T lymphocytes, and humoral immunity carried out by B cells, and cell mediated immunity carried by or mediated by T cells. Okay, the next, lateral S-shaped curvature of the spine is called scoliosis. Okay, then here you can see the types of uh, spine curvatures. Here you can see scoliosis is an S shape, and here if the lower back curve you can see, that you can call lordosis. And if upper back, okay, in the spinal cord if you see a curve at upper side, that you can call upper back curve. The next question is the radiological examination using a minimal and safe amount of radiation to allow visualization of breast masses. So what is the type of radiological examination? And the answer is mammography. And here you can see the mammography is one type of X-ray imaging technique, and this mammography we can use to detect the breast cancer in the women. I hope you like my content, and please subscribe to my channel. Thank you.